We are Group 18 and our topic is on unintended pregnancy.
The target behavior we're going to be studying today is going to be parents having the talk with their adolescents about practicing safe sex. According to JAMA Pediatrics, adolescents who have had the sex talk with their parents are more likely to use condoms and birth control, and they have also found the link between parental communication and safer sex practices strongest for girls and teenagers who have talked with their mothers. According to the CDC, about 50% of high school students have engaged in sexual intercourse, with 60% of that population reported using a condom and 14% reporting not using any form of contraception. Though we have seen a steady decline since the early 2000s, the rate of teen pregnancy in the U.S. is still substantially higher than any other Western industrialized nation.
According to Planned Parenthood, most teens name their parents as the biggest influence in their decisions about sex. When there's good communication between parents and youth, it's been shown that youth report older age of first intercourse and lower frequency of sex during adolescence than their peers. Teens who have frequent conversations with their parents regarding sex are also more likely to use condoms and other forms of birth control when they become sexually active.
Our primary audience are parents of sexually active adolescents, typically in 9th and 10th grade. Our persona is Robert, who is married in his mid-40s. He has 3 kids, and the only type of social media he actively uses is Facebook. He did not talk to his eldest about sex, but wants to be engaged in his children's lives. He plans to learn how to effectively give them advice when it comes to sexual activity topics.
Our secondary audience are 9th and 10th grade students. Our persona is a student named Michelle. Michelle is a 15-year-old 10th grade student at San Diego High School. One day at school, her friends start to talk about sex. She was curious about sex and wants to ask her mother some questions. Michelle has a conversation with her mother and now feels knowledgeable about sex.
One of the main channels we're going to be using is Facebook, because parents are known to use Facebook more than any other social media. We will use PSA videos, create groups, and have advertisements to emphasize the importance of this issue to parents.
For our other channel, we thought it would be most effective to have print media in the form of colorful posters with our message printed on them in places where the parents might see them, such as a doctor's office or in their child's school office, and also to have pamphlets with that same message that they could take with them.
One of the messages that we want people to take away from this program is to be open to talk to your kids about practicing safe sex and other important sex-related topics, such as STDs, pregnancy prevention, and getting tested. The appeal would lean more towards the light, being that it is more logical and presents suggestion based only on facts. The facts being those that will be listed on both the flyers and those on the Facebook page. This message will also be an example of a gain-framed model, emphasizing the benefits of parents giving the talk to their children. It will be a central route because it will be portrayed on flyers and Facebook pages with meaningful statistics and distributed in clinics, nursing offices, and well-known health agencies. Another message that we want people to take away from our program is that condoms are not the only thing that prevents unintended pregnancies. This will also be a light appeal because it's logical that condoms are a good start in unintended pregnancy prevention, but other ways could be more effective for different people. This will be a gain-framed model because it demonstrates how usage of condoms or other applications of safe sex will not result in unintended pregnancy. This will be a peripheral route because the initial message will only provide brief statistics that are backed by doctors and other health professionals.